Hi, I'm Brandy G, the Community MP.
And I'm Brandy B, also the Community MP. And today we're going to talk about high blood pressure.
The silent killer. All right.
Okay, Brandy, so what is high blood pressure?
All right. High blood pressure is when the force of blood pushing against the walls of your blood vessel is consistently high. So when you think about your blood pressure, when you get your blood pressure checked, there's two numbers. There's a top number and there's a bottom number. The top number is the pressure inside the arteries when your heart is contracting. The bottom number is the pressure inside the arteries when your heart is relaxed. So that's typically that's the medical terminology of what high blood pressure is.
Okay, perfect. And so who's at risk? The people at risk for high blood pressure are people that consume, a lot of salt, people that drink a lot of alcohol, people that smoke. If you live a sedentary lifestyle, like you don't exercise, you go to work, come home, just sit on the couch. So anybody that isn't, physically active, they're at risk for high blood pressure. Also, and these are things that, everything that I've listed so far are things that you have control over. So, and then also illicit drug use like methamphetamines or cocaine, those put you at high risk for blood pressure as well. Some of the other things that put you at risk are your age, which you have no control over. As we get older, it is what it is. We're at a higher risk of getting higher blood pressure. Mm-hmm. And then family history. What does it be? Is if you have two...
if you have one or two of your parents, one or two of your parents who have a history of hypertension, sometimes you can have some genetics that can cause you also to be a hypertensive patient or also have high blood pressure also.
Okay, so that's something also that you don't really have any control over. And then some genetic diseases put you at higher risk of having high blood pressure. So those are things that you just have to discuss with your doctor. If you have some... issues that run in your family, then just let your doctor know and they'll be the ones to determine if, it puts you at higher risk or not. But either way, there's not a lot that you can do about genetics.
So one of the things that I found interesting with that is puts you at risk for high blood pressure, they had race. They had certain race, African Americans, of course. They said that they were at greater risk for high blood pressure. So I was wondering, exactly why.
Yeah.
And you can talk about it if you want to talk about it, B. It's up to you.
Well, we can both talk about it.
Okay.
So, a lot of times in our race, because it has a lot to do with what we're exposed to. Sometimes people come into the clinic and they're like, well, my dad had high blood pressure, my grandma, my brother. Well, that doesn't necessarily mean that you're going to have high blood pressure. It may put you at a little bit greater risk, but also the problem is, we are exposed to the same things. So we eat the same, we live the same lifestyle. So if mom, dad, grandma all eat, like pork and then we grow up and we eat is pork and, unhealthy stuff, then of course we're going to have the same problems that grandma, dad, mom all have as well. So it's not, some of it's genetics, but a lot of it is habit.
Yeah. So yeah. And it was saying that, I guess socioeconomic, your background can also put you at a greater risk, I guess, because you don't have the opportunity to go get healthy foods or, the healthier fresh fruits or vegetables. So that puts you at a greater risk also. So I thought that was interesting.
Yeah,
also.
That is, yeah.
Okay.
And then, of course, obesity. So that's one of the major problems with a lot of health conditions is being obese. And it's just a very common thing in the United States, probably because of our portion size, our, how easy it is for us to access foods, like unhealthy foods. Like, of course, you can go to McDonald's and get almost a whole meal for $5. You try to go get a healthy meal, you're going to pay like 10 to 12. People can't afford that. So we just got to be more mindful of those things and try to make healthier decisions.
Okay. So a lot of my patients always ask, well, Miss Brandy, what is normal blood pressure? What should my blood pressure be? So what is... So a healthy blood pressure is the top number, the systolic blood pressure, is being less than 120, and the bottom number, your diastolic blood pressure, is being less than 80. So you want less than 120 over 80, okay? Mm-hmm. Elevated blood pressure is when that top number is greater than 120 to 129, And the bottom number, that diastolic number, is greater than 80. Okay? But then you go to different stages of hypertension. Mm-hmm. You have stage 1 and you have stage 2. So stage 1 is when that top number is between 130 and 139, and that bottom number is between 80 and 89.
Yeah.
Then stage 2 is when the top number is greater than 140 and the bottom number is greater than 90.
Yeah. So stage 2, that's when, we start to get concerned, and the higher your blood pressure goes, the more you're at risk for. So we're going to talk about some of the things that having high blood pressure can put you at risk for. So let's see, B, what's some things that blood pressure can cause?
So high blood pressure can damage several of your organs, such as your heart, your brain, your kidneys, and your eyes, okay? So when it damages your heart, what happens is it decreases the blood flow to your heart, which causes chest pain, can cause a heart attack, and can cause heart failure. It also can cause the arteries that supply oxygen to your brain. It can cause that to be blocked, or it cause those arteries to burst, which can cause a stroke. Okay?
Yeah.
And also it can put you at increased risk for kidney damage, what leads you to what, B?
Could lead to dialysis at the last resort, but there's several different stages of kidney damage. So basically what I'm saying is you have time to get your blood pressure under control and prevent yourself from having to be on dialysis. So what are some symptoms that you should look for to determine if you have high blood pressure? Basically, some of the most common symptoms are headaches, blurred vision. You may feel lightheaded or dizzy. Some people have nosebleeds, shortness of breath, as we discussed, chest pain. Of course, if you have like chest pain, palpitation, shortness of breath, those are symptoms that you want to immediately go to the emergency room for. The other symptoms, if you start to have, like the headaches, blurred vision, that's okay. You can go to your primary care provider and let them know what your symptoms are, and they can, you can have your blood pressure checked in clinic to see what it is and see if you need to start treatment for it.
Okay, but one of the symptoms that I would like to talk about is sometimes you don't have any symptoms at all.
That's very true.
A lot of our patients don't have any symptoms at all, so that's why they call it the silent killer.
Yeah. And so a lot of people, like she said, don't have symptoms. And the reason why is usually their body's just adapted to living with an elevated blood pressure, which is not good, because even though your body's used to it, you still can have a heart attack or stroke from it.
And usually when you do have those symptoms, B, it means that you've probably been having it for a while.
Yeah.
So when you start having those symptoms, you start getting those problems with those organs. So you've probably been dealing with high blood pressure for a while. Yeah. So that's when you become symptomatic with it.
Yeah, that's true. That's very true.
Yes.
So what do we suggest you do to prevent or to help control your blood pressure?
I just have one thing to say.
What?
If you have high blood pressure and if you are on medications for high blood pressure, take your medication.
Yes.
I have so many patients who tell me daily, I feel better. I stopped taking my medication because I feel a whole lot better. Yeah. My blood pressure is controlled now, and I don't have to take the medicines anymore. Please take your medications. If you have any problems with your medications, allergic reactions, notify your primary care doctor and let them adjust or remove the medications. But I ask you just to please take your medications.
And then to kind of tag on to that, they'll feel better and they're saying, I took myself off that medicine, I'm fine now. And then we'll check their blood pressure and it'll be like 200 over 100, and we know that's not good. So maybe they do feel better. The medicine made you feel better while you were on it. You stopped taking it, now your blood pressure is right back to what it was. So if you want to come off medicine, it's fine. You just got to let your primary care provider know, and then they can help you wean off but you got to do it in a safe way, or otherwise, like we always go back to, it can lead to a heart attack and stroke. The other thing is checking your blood pressure at home. Make sure you have a blood pressure machine. Check your blood pressure routinely. Write your numbers down. Take your blood pressure machine and your readings to every appointment that you go to.
So one of the other things is, I'm going to give you an example this morning. So one of the things that you can do to lower your blood pressure, if you are a smoker, stop smoking. I had a patient came in to see me this morning. Blood pressure was high, 180 over 106. Guess what? He said, I took my blood pressure before I came, but I just had a cigarette.
Oh.
So,
yeah.
The blood pressure is going to be high.
Yeah.
So, that's one of the things is to quit smoking, okay?
Mm-hmm.
Reduce the amount of salt intake into your diet. I tell my patients if they can stay away from pork, and if they can, canned goods.
Mm-hmm.
Canned goods have so much sodium in it. So if they can do, and if they have to use canned goods, rinse that sodium off those vegetables.
That's a good idea.
Try to do fresh vegetables or frozen.
Yeah.
Other than canned goods, okay? So that's one of the things I tell them. Exercise.
Mm-hmm.
B, I know you're big with exercise. You have me exercising now at least 30 minutes a day, okay?
Yeah.
So you do have me exercising. So
Good.
It's good for the patients to exercise at least 30 minutes a day, most days of the week.
Yeah.
I'm not talking about one day a week.
Yeah. And when we say exercise, we mean like getting your heart rate up. We probably will mention exercise in almost every single video that we do because it's so good for you. But getting your heart rate up to, where you're like breaking a sweat. So not just
walking around my apartment complex.
Walking around your apartment complex at a fast pace.
Okay. Working when I'm at work, walking up and down the hallway.
No, that doesn't count because you're stopping and going. So no. But like getting outside, you can walk on a treadmill, you can ride a bike, just something consistent for 30 minutes. Of course, if you want to run, sure, you can run. That's an excellent cardio, but not everybody can do that. So we don't expect everybody to be able to do that. And so of course, eating healthy, low sodium, make sure your diet is full of like fruits, vegetables. If you eat meat, make sure they're lean meats like turkey, chicken, fish, and grilled or baked, not fried.
But that's my next question. So you telling me I can have fried chicken?
I am not telling you can have fried chicken.
Okay.
Good try.
Okay.
And then also, dairy products have a lot of fat and stuff in them. So try to minimize your dairy consumption, like milk, eggs, cheese. Super unhealthy, but there's alternatives to milk like almond milk, cashew milk. There's even alternatives to cheese and stuff.
I like the cashew cheese.
Yeah,
I just tried it.
I
like
good.
That. Okay,
yeah.
It is good.
Yeah.
Okay, and what about cutting down alcohol intake? So if you're drinking more than 2 drinks a day,
you gotta cut back.
Yeah,
you gotta cut
because that will also play a part in raising your blood pressure. Drinking more than 2 drinks a day, also. Okay.
Yeah.
I think that's some good tips.
I do too.
On how to lower your blood pressure.
Yeah.
I hope you guys enjoying this.
I hope so too. So, and then, we know that a lot of insurance companies don't pay for blood pressure monitors. So we are actually going to give away 6 blood pressure monitors. We have 3 of the, what are these? The ones that go on your arm, and we have 3 of the wrist cuffs that we're gonna give away as well. But so basically, in order to get these, what do they have to do, B?
They're gonna first of all, you're gonna have to follow us on our Instagram, okay? BNB the Community MPs, and also go subscribe to our YouTube channel, BNB the Community MPs, and we'll make sure we put all that up on our Instagram channel so you can click the link and subscribe to our YouTube channel.
Yeah, and we hope that you not only subscribe, to get the free monitor, but to just, learn stuff about your health, because our whole goal is to have a healthy community. We want to be able to, teach you about things to make you healthier.
Because YB?
Beauty
is our community.
Yeah.
Okay. So we have to have a disclaimer. Our resources, no disclaimer. I keep saying disclaimer, but we have no disclaimer because we're not getting paid to do these videos. Yeah. Okay. But the resources that we use today was from the CDC and from Up to Date.
Yeah. And like us, subscribe to us, follow us, leave feedback. We greatly appreciate any feedback that you have for us. And have a good day.